United Nations Children's Fund, Impact, Vision, and Mission. Organizations' work impact. UNICEF has played a vital role in addressing the community's safety and health requirements. For example, the group has aided children's social services and health. The organization has also had a significant impact on the lives of women and children by addressing health and safety issues. The provision of health services by UNICEF has also facilitated the reduction in death rates as a result of improved healthcare services. The organization has provided roughly $2 million to various communities worldwide to promote and expand community health systems for both children and women. As a result, the majority of people will benefit socially and economically. Many children have benefited from the firm's support for hygiene, education, and social protection. Women's and children's welfare has generally improved as healthcare services have improved. Additionally, the group plans to keep the momentum going on gender socialization by bolstering large-scale programs that target discriminatory gender norms and prioritizing evidence development, advocacy, and strategic alliances. UNICEF will devote additional attention in the coming years to children and adolescents who have been displaced due to long-term crises, disasters, or conflict. It is vital to guarantee that these girls and boys, especially those with disabilities, have access to essential services and platforms accessible and inclusive to engage in preparedness measures, humanitarian programs, and peace processes. UNICEF will also reaffirm its commitment to increasing access to data on teenage girls and boys and disaggregating current data to highlight discrepancies. In development and humanitarian situations, the organization will continue to help girls and boys with disabilities fully engage in society by providing disability-inclusive and accessible programs and services and access to assistive technology. The organization will improve the gathering of disability disaggregated data, improve evidence-based programming for disabled children, and encourage humanitarian responses that safeguard and meet their needs. In addition, UNICEF will look at new ways of working with various partners. These include firms, philanthropists, and foundations that want to use their resources, influence, reach, or business experience to fight gender stereotypes and improve the lives of millions of girls and boys. As a result, with UNICEF's assistance, society has gained the help of promoting excellent healthcare services for women and children. Organization's vision and mission in improving public health and safety. The organizational mission of UNICEF is to advocate for children's rights and protection. Little ones are also helped by the organization to realize their full potential, meet their basic human requirements, and increase their potential and chances. It also strives to provide safety and assistance to mothers and children in times of disaster. In this context, the organization's role is to aid society's most vulnerable citizens in the event of poverty, tragedy, or violence. It attempts to ensure that there are ethics in matters affecting children's conduct and promotes worldwide standards with the support of the organizational mission. UNICEF also strives to assist in the event of a crisis to protect children. On the other hand, the UNICEF mission is to make a difference in the lives of youngsters. As stated in its mission statements, the organization's principal objective is to create a better world in which all children's rights are respected. Furthermore, the mission statement emphasizes the need to enhance the lives of society's less fortunate children. The safety of youngsters is increased as a result of the organization's mission and vision. A lack of healthcare causes the majority of deaths of children worldwide. However, if UNICEF's vision and purpose are implemented, the claims will be small. Working with the organization would allow one to deliver the most significant healthcare to children as a nurse. Impact of funding sources, policy, and legislation. UNICEF financing services, legislation, and policy services have a variety of significant consequences. With UNICEF financing, a variety of upgraded healthcare facilities and institutions have been built. The facilities have played an important part in community service, women's issues, and children's issues. Rural funding has helped to lower the death rate among expecting moms and children. Furthermore, UNICEF has ensured that children and women have equal access to nourishment through financial assistance. Malnutrition difficulties among children and women have been dramatically reduced in this scenario. Additionally, in 2018, UNICEF assisted in generating new evidence on child poverty, providing helpful content for the organization and other stakeholders to advocate for appropriate programs and policies. For example, the group helped Côte d'Ivoire analyze child poverty, which was an important advocacy tool for social ministries negotiating a higher public investment in social sectors. This made the firm draw more attention to the country's poorest districts. In Trinidad and Tobago, the analysis was complemented with a book of child poverty images that captured children's voices from the research, offering a practical and novel lobbying tool. UNICEF supported a multidimensional child poverty analysis in Morocco, which was distributed at the national and subnational levels in 2018. As a result, this reaffirmed the need for child-centered policy solutions and generated debate in Parliament, with lawmakers asking the administration specific questions about how public policies will alleviate child poverty and deprivation. A nurse working with the organization would assist in the fight against hunger by providing critical nutrients. Children's and women's vulnerability, as well as poverty, are addressed through UNICEF policy. There is social protection of community health with the support of the organization. UNICEF assists in ensuring environmental security after natural catastrophes. The organization's legislative issues aim to promote equity in providing services to children and women in many communities around the world. Thus, a nurse would collaborate with the organization to improve its policies and laws. Organization's ability, promoting equal opportunity and life. The organization's goal in all nations where they work is to establish and promote equal opportunity for all women and children. UNICEF is active in over 130 countries. In this context, the organization's ability to deliver services to individuals has aided children in expanding their horizons and realizing their full potential. Equality of government spending on youth. Due to this, expenditure is only assessed irregularly and in fewer places since existing information is frequently outdated. This is an ambitious and challenging task. It will need to pursue more partnerships and promote more vital working from both the nations and key international organizations that can assist in making a significant difference like the World Bank in this sector. The global refugee problem has underlined the need for mechanisms to protect children's rights and assure additional investment in policies that allow them to have their productive capacity, even when they are pressured to relocate, more than ever before. A nurse would try to improve and enhance the organization's excellent healthcare services to the public. In the event of an emergency, nurses should also be available to assist the organization. The frequency of mortality among children and expecting women has decreased because of the organization's assistance. UNICEF has also been at the forefront of efforts to reduce gender disparities in the community. Nurses should also collaborate with the group to promote societal equality.